After scraping the impression, to remove all the excess green stick that comes inside the tray, I'll just leave 2 millimeters of the green stick compound over the border of the tray. Now I'm going to take the zinc oxide eugenol impression. I have to apply 2 equal amounts from the material. For the lower, because the size, the area I'm going to take is smaller, I have to take just 1 line and a half from the material. Don't place excess material, otherwise the impression will be thick borders. Equal amount from the base and from the catalyst. They should be equal in amount. I get my spatula. I take the material by the spatula, as you see, and I will start mixing the material. The mix should be in one direction so that not to entrap any air bubbles inside the mix. Then I have to take the material all over again to be sure that there is no material not mixed on the base of the rubber pad. I mix until I have a homogeneous mix. The color should be not white and not blue. As you see, the material with me is going to be homogeneous. I'll take the material and I start spreading the material all over the tray. After applying the material, I can use the wax knife just to re-spread the material over the tray and not for making the impression or mixing the impression. Any excess material I can remove it from the tray so that you don't have a thick borders. I spread the material in the fitting surface and also on the border of the tray. I remove any excess material that I can feel it. Now I'm ready to take the impression. I'll go in front of the patient. I rotate the tray. I insert the tray slowly inside the patient mouth. For the anterior area, upward and inward. Buccally, upward and inward. For the other side, upward and inward. Slight movement. Distobuccal area اقفل يا عم الحاج على الصابع. بس شكرا. Slight movement for the distobuccal area on both sides. طلع لسانك يمين وشمال. For the lingual side بخلي العين يحرك لسانه يمين وشمال. شكرا يا حاج. وبخلي البيشنت. Then I ask the patient to move his tongue forward. طلع لسانك قدام يا حاج. بس شكرا. All this movement, the tongue should be inside the patient mouth, not to protrude the tongue outside the patient mouth. Otherwise, this is not a physiological movement. I keep holding the material inside the patient mouth until it sets. The material takes about 5 minutes until it sets inside the patient mouth. My fingers are keeping holding the tray in position while holding the mandible so that to keep the tray in position and keep the impression in location until the material sets. I check by my finger on the excess material. When your fingerprint is still present, that means the material doesn't set yet. I have to wait until the material sets. Every now and then I check the material by my finger. My finger shouldn't, if you see, this is my finger pressure. You can see my fingerprint is still present. I have to wait until the material sets. Never to leave the impression inside the patient mouth to check that the excess on the paper pad has set or no, because inside the patient mouth it sets faster because there is a higher temperature inside the patient mouth. The material didn't set yet. I'm checking it one more time. When the material sets, now I touch it, no impression from my finger inside the patient mouth. So you can see no pressure, no fingerprint is present. I can remove the tray from the patient mouth. Slowly I remove the impression from the patient mouth and I place it on the table. You can find that the borders are recorded, all the borders are recorded with the zinc oxide. Fitting surface is recorded. Lingual pouch is recorded with me. I can see the lingual pouch recorded, rounded and smooth. Retromolar pad is recorded. Distobuccal area is smooth and rounded. Slight pressure area is present in the anterior part, and this pressure area, once it is covered by the zinc oxide, it is accepted. No problem in it. You can see that all the borders is recorded with me, smooth and rounded and properly correct border. Thank you.